I was feeling pretty horrible. I was very run down. I have 2 kids, so I needed to be on with my kids and my job and my husband, which made it very difficult.
She was having menorrhagia, and menorrhagia is excessive bleeding. It's oftentimes related to fibroids, but on workup and after evaluation, we found that Jessica had a disease called adenomyosis. Adenomyosis is adeno, meaning gland, and meiosis into the muscle. It's an overgrowth of the glandular tissue of the uterus, which can also cause excessive bleeding.
My doctor that I originally saw for my problem was suggesting a full hysterectomy. So when I spoke to Dr. Chingesi about it and he suggested the uterine artery embolization, I was shocked and so excited that I was going to be able to have this outpatient procedure that was going to essentially make me feel better and fix my problems.
Jessica underwent a uterine artery embolization to help reduce the blood supply to the adenomyosis, after which her bleeding completely stopped and she no longer has any issues with menorrhagia whatsoever.
The nurses, the techs that were in the procedure, everybody made me feel like I was at home, very comfortable. They made me kind of feel like we were friends and that I had known them for a long time.
This is an example of her left uterine artery, which is dilated and tortuous, and then downstream filling in all of that abnormal glandular tissue of the uterus. After embolization, this is what her uterine artery looks like. So the artery is still patent, it is still flowing forward, but all of that downstream adenomyosis is not filling in nearly as much. Her symptoms completely improved. She stopped bleeding and did very well with the procedure.
I was in the office for probably about 3 hours, and then the recovery was pretty quick. I had the procedure on a Thursday, and I was at my daughter's softball tournament on Saturday. I tell people all the time, and it sounds funny, but I really truly mean that Dr. Chingesi saved my life.